7, your Suncoast News. We're here for you.
This may sound a little sci-fi, but it's not. A company in California has developed a tiny sensor that can be added to medication to track whether or not a patient has remembered to take their pills. Dr. Dean Sutherland is here to tell us why this innovation is useful. All right, thanks for being with us this morning.
Good morning.
So this is cool. You take the pill, the sensor is in there. It's just a tiny little sensor. So tell us how this works.
The sensor is the size of a grain of sand.
That's crazy.
Extremely tiny.
Yeah.
And there's a patch that you can apply to your skin. I assume it's going to be over the stomach. And the sensor then will talk to the patch, and then the patch will talk to some other device like a Bluetooth phone and tell whether or not the pill has actually been taken.
It's just amazing to me.
Yeah. So as you can imagine, it could be very helpful for people who can't remember to take their medications or who have to take their medications, like they have insulin-dependent diabetes or for tuberculosis patients, you know, people who is really critical that they take their medication.
And then I was also reading renal patients as well, because they usually have a long list of medications. It's sometimes hard to remember to take all of them. Okay.
Right, they come in with 20 medications, and if they don't take their medications, they can have a rejection of their transplant.
Wow. Okay. So once you take this pill, let's talk about the actual science behind how it communicates, gets in your stomach, and that's what sets it off, right?
I don't understand the actual technology.
Okay, yeah, that might be a little for all the techie guys who created this, but I guess it's something about the stomach juices that set off the sensor.
Right, so the pill is inside, and the sensor is inside the pill, but after you actually start to digest the pill, then the sensor gets connected and it can form a bridge just by using, I guess, the salt water that's in your stomach or anything else. And then once that connection is made, then it signals the patch, and then the patch signals your device that senses that. And so it can track multiple things throughout the day. So imagine if you could track from home and say, okay, I wonder if my dad, who has a memory problem, is taking his medications. You know, if you could track that from your office on your computer and just try to figure out whether or not meds have been taken.
And even if for someone who maybe just takes, like even for me, takes just a few medications, sometimes you go through the motions in the morning and you're doing this, and you think, did I take that? Did I go over there? Did I get my pill? You just forget sometimes. So this is not just only for people who are forgetful. This would be helpful for a lot of people, especially, as we mentioned, those with a lot of medications.
Sure, or if you never take pills and now you have to take something 4 times a day like an antibiotic, you know, right? It's hard to do that.
Okay, and especially maybe for senior patients as well.
Nursing home patients, this would be very important in hospitals to track and make sure that, you know, you could reduce medication errors and problems with getting the wrong medication, you know. If you could actually pinpoint it to be very specific for one particular medication, or make sure you didn't get someone else's.
And when will we expect to actually see this being used?
I don't know. It's actually been invested in by some very large companies.
Yeah.
Novartis, and they're paying a lot of money to develop this technology. I think it's going to happen. It's like, remember when you heard about robotic surgery and you're thinking,
you
that's
thought,
not going to happen.
That's crazy.
Right. I'm sure that this is something that's going to happen. Just don't know when, but I think it's exciting. It's kind of Big Brother-ish, so we're worried about that aspect of it.
But in a good way. This is just to make sure you're doing the things that are great for your health.
Right.
So, all right. Thank you, Dr. Sutherland. Very cool topic this morning. And now let's head over to Chuck, take a look at our traffic.
Thanks, Kelly. We do have an